Hi, everyone. We're back for our last session. We have one speaker for our last session. And as I mentioned earlier, we're going to be drilling down into the challenge of financing juvenile justice change and reform. And to take us through that, it's a complicated subject that we can't possibly cover just in a half hour, but we're going to try our best. And if there's anyone who could do it, it's Samantha Harvell, who's a principal policy associate at the Urban Institute. She's a developmental psychologist with more than 15 years of practice, and her full bio is on our conference page. You can look at that later. But I wanted to start quickly with Samantha to start us off. Maybe she has a few points to raise, and she also has a diagram that we're going to put online as well to help along. Help all of you guide the talk. So Samantha, take it away, and we'll put that visual on as soon as we can.
Great. Thanks so much, Steve. Can you hear me okay?
Yes, we can.
Wonderful. Thanks so much for the opportunity. So as you mentioned, it is a big topic, lots to cover, and certainly could talk for probably a whole session, whole afternoon, much less 30 minutes, but I'm excited to have an opportunity to talk a little bit about it, and happy to follow up with anyone who might be interested in more information. So just in terms of kind of a brief framework, juvenile justice funding, the majority of it is state and local, a state and local function. That's true on the criminal justice side as well. But federal investment on the juvenile justice side has really declined significantly over the past couple of decades. And at this point, the federal government is only spending about $300 million a year, which is much, much smaller than what we've seen spending at the state and local level. For example, the state of California spends almost that much just in that single state alone. Another sort of just key takeaway from my perspective is one that those of us in the field have sort of come to know, but increasingly we just keep coming back to, that incarceration for youth is expensive and really ineffective. It's not cost efficient, and it doesn't produce positive outcomes for kids. There was a report put out by the Justice Policy Institute earlier this year talking about the fact that now the average cost of incarcerating a child is almost $600 per day, more than $200,000 for a year. Part of that is because we have decreased the population of youth that are incarcerated, but part of it is because that it's hard to close facilities. There's a lot of costs that come down with that. So the per individual cost keeps getting higher and higher. And generally incarceration, it both sort of disconnects kids from the family and support networks in which they thrive. It interferes with positive youth development, and generally does actually a poor job of preventing reoffending. So there's really been, in the past couple of years, I think, increased attention to the critical need to invest in community-based services for youth in the justice system. And that's, I think, the visual that Steve was referencing. In a report that we did last year, we started to sort of articulate what we call a continuum of care and opportunity for kids. Especially for kids who experience concentrated disadvantage and are overrepresented, as well as youth of color in the juvenile justice system, and particularly in incarceration as well. We sort of see this as kind of the next frontier, is figuring out how to resource and fund this full set of supports for youth that we see as critically important. Apologies, and I think Steve just placed that up there now. So the other thing being that the community-based alternatives to incarceration and many of the sort of community-centered, family-centered strategies that are more effective in promoting long-term behavior change, they're also more cost-effective and cost-efficient. But in making that argument, I think we've done ourselves a bit of a disservice insofar as we've often talked about, many folks in the field, the cost savings that accrue if you sort of opt for a community-based alternative rather than incarceration. I think the danger, and particularly in the COVID era that we're seeing now, is that when we do that, it can result in significant divestment in exactly the kinds of services and opportunities and resources that youth involved in the justice system need in order to thrive. So we're already seeing in several places now stories coming out of, apologies, I just wanted to make sure I still have you. Can you still hear me, Steve?
Yes, we're fine.
Yeah, okay, good. Sorry, I lost the, apologize. I lost the visual of you all. I see you're there, this virtual world. So we're already seeing stories of state cuts to programs, particularly diversion programs that help keep kids from coming into the system to begin with, but also for some of the alternatives to incarceration. One of the stories that I'm happy to provide the background resource, but linked, it was talking about the Youth Advocates Program that's had a lot of success across the country, really working with youth who are at highest risk and have committed some of the most serious offenses in terms of alternatives to incarceration at home. And so we're starting to see those stories. And I think that's going to be one of the real, I think, important areas of focus in the next year, is while states are in this COVID budget crunch, really thinking about strategies to invest in this full continuum of care. And I wanted to flag, and I think part of the reason I was invited to present today is we did put out a paper last year focused on promoting a new direction in youth justice and strategies to fund these community-based alternatives and approach. And we were really impressed with the wide range of strategies that we saw across the country at the state and local level that states and localities are using to fund sustainable funding streams for youth services within the continuum. So we saw everything from new reinvestment programs. One was just launched a couple of years ago in California. We've seen new taxes levied in various jurisdictions to support violence prevention and intervention services. We saw a really creative model in Fort Worth, Texas, where a former congregate care facility was actually leased out and the ground repurposed for a successful shopping mall that's generating revenue about $1 million a year, that's supporting services for youth who were formerly the type of youth who were formerly held in the facility. So lots of creative strategies. Happy to talk more about that. But just given that we have, not a ton of time, I wanted to open it up and see if you had questions, Steve, or others did, where your questions are and how I can be most helpful as to kind of help your thinking as you're thinking about stories in this area.
Well, let me start off with one question, and actually it was brought up yesterday by our keynote speaker, Nate Bayless. Mm-hmm. He said that the pandemic itself has created a kind of interesting opportunity for people to re-examine youth justice across the board. And one of them is that if we don't need that many lockups anymore, for the kind of keep kids out in the communities rather than bring them in to facilities where they would be in danger of or at risk of being infected and staff is at risk. And if we don't need them, then we can sort of rethink how we invest in those fixed costs and think about investing in community services, community intervention. So is that a real either or situation? I mean, is that practical? Can local jurisdictions begin thinking in those terms, and would it actually save money and help us on that path to real change?
That's a great question. And I think it's absolutely real. And I think we actually even have a preview in the juvenile justice space because we have seen populations declining for more than a decade now. Almost every state has closed at least a small facility. We have some states now that actually have closed their last large youth prison. Connecticut it comes to mind as one that most recently closed their last large kind of congregate care facility, opting for smaller, local placements. I think it's absolutely a real opportunity. Several states are demonstrating the ability to do that. Kansas is one that comes to mind just in terms of a diversity geographically. They really overhauled their system back in 2014 or 2015, significantly decreased the population. They closed facilities. And the key then is really capturing that savings for reinvestment. So to your point, it's absolutely a real option. Closing facilities is hard. They are, employment opportunities in some areas. Like that's not it. It's not necessarily easy to do. There are labor challenges in others, but it absolutely can be done. And the key is really then making sure that that savings doesn't go back up to shore up, state budget gaps generally in the general fund or elsewhere, but then really figuring out how to capture those resources. So we highlight in the report Kansas specifically because their legislation created a lockbox, so to speak. It was really prescriptive about how savings were identified and then where they were placed. So now the state has been able to use those resources to invest in evidence-based family therapy programs across the state. They've been able to increase access for kids in more rural communities, kids and families in more rural communities. And that's just one example. Virginia is another. That's my home state. I live north of Richmond, Virginia. Here, they've done the same. We had when I started in this field, we had 7 youth prisons. We then had 2. And in the last year, they closed one, invested significantly in 2 different local providers to offer evidence-based, community-based programming in the eastern and western parts of the state. So the short answer to your question is it's not easily done, but it absolutely is done. And I think it's a real opportunity in probably most states, and ones that they're grappling with and kind of thinking through is how to reallocate, reinvest, repurpose, however you want to sort of say it, into these proven community-based alternatives.
So thank you. We have a couple of questions coming in, but I want to follow up on that because this is a particularly hard part of the story to cover. It's easy to cover the poignant hard luck stories, but covering finance, particularly in any area of justice, is always difficult. So I wonder if there's any tips you can provide or any avenues into covering it that might help journalists in trying to get at this really important question.
Yeah, no, that's a great question. It's a hard one. And as somebody who works both on the criminal justice and juvenile justice side, I do think in the juvenile justice space, I think that policymakers and stakeholders sometimes think of juvenile justice slightly differently than they do criminal justice. And I think it helps us. It's unfortunate because I wish we didn't. I wish we thought about the need for sort of comprehensive support services for everyone. But that case is sometimes easier to make when you're talking about youth, right? When you have cross systems, youth participating in, maybe engagement in the justice system, maybe engagement in the child welfare system, maybe coming up as having, not showing up or struggling in the education system. I think because of these networks and sort of quote unquote safety networks that we have for kids, it's a little bit easier sometimes to argue for kind of smarter allocation across agencies and across that safety net to support youth, and ideally sort of helping them not get to the juvenile justice system. It's sort of the one of last resort. They have to house youth that are adjudicated to be incarcerated, like that they have to pay for prison beds. But I think that we can flip the script on that, and I think states and localities are, and I think focusing on that that sort of holistic approach for supporting kids and families is one that works more effectively on the JJ side sometimes. You
have, Samantha, one really stunning figure in your paper, which is that the average state cost of youth incarceration is $588 a day. Can you break that down? How did you calculate that?
So that was citing a Justice Policy Institute story. Happy to link to that. Sorry, report, not story. Excuse me. I'm thinking my mind's in reporter mode. It was a report the Justice Policy Institute put out earlier this year. The figures are calculated based on available data at the state level in terms of what the state operating budgets are for youth prisons and how many kids are in them. So to be totally honest, a number is increasing in part because it's expensive, but in part because the kids are decreasing. growing. And so the number of kids that are in them are smaller. And so therefore the cost per kid increases. And so part of it is because they're emptying out, and it really makes the case for shutting them down in cases where that's possible. And in many cases that is possible, and repurposing those resources, because I think that can be a really significant influx of resources to support that more holistic community-based approach.
Let me get to a couple of the questions we have. Michael, do you want to read some of them off? We have a couple in our Q&A box.
Thanks, Michael.
Yeah, sure. Thank you. So one journalist would like to know, to what extent does the profit motive hamper a substantial turn to community-based solutions?
That's a great question, and a complicated one. So there's huge variation from state to state in terms of how juvenile justice services are organized. In some states, they're very privatized. Florida and Pennsylvania come to mind as ones where a lot of youth held in out-of-home placement, and as well as some of the treatment in the community is privately run. So, and there was a scandal several years ago in Pennsylvania that it was awful. It was sort of a kids for cash scandal showing that there were adjudications of youth for profit, which is horrifying. And I think the exception, not necessarily the rule. So a couple of things. I think that it can potentially hamper it. I do think, though, juvenile justice is at a point now where a lot of places have seen the writing on the wall, sort of in a similar way to child welfare. You know, we're a much more family-centered, trying to keep kids in the home. I think this idea of community-based strategies being more effective is one that's permeated for a while. And so several of the residential placement providers that I'm aware of do both residential and now community-based as well. So there's some diversifying. All to say, I think it's an element of the story, and I think it's potentially an element in specific places. And so, Isaac, if you want to follow up and sort of talk about any specific locations that you're interested in, we could explore that. But I don't know that I don't know that it's one of the main sort of parts of the story lately that's been discussed.
In our upcoming sessions of the series, we're going to be looking more specifically at community supervision and changes in that. But there's a question from Charlotte West I want to go to right now, because I mean, it is mentioned in your paper that, and we know this, that jurisdictions are particularly strained with all the costs of COVID that COVID has imposed, plus cutbacks in revenue. And Charlotte West is asking that whether you've seen cuts in funding for services such as education and mental health services, and what are the first things to be hit in the youth justice system when states start to cut?
Yeah, no, it's exactly that. I feel like it's sort of a common story across topics when it comes to that. I've started to just see some of the recent stories, like actually seeing budget cuts coming into play. It's often early intervention diversion programs. I think those are the ones I had seen in Florida. I think I just saw a story in Georgia around a mental health funding program that was going to impact justice-involved youth as well. And so, exactly as you said, I think the first ones to go are the ones that perhaps have the most bang for the buck, but are the ones that don't necessarily, sort of solve the immediate sort of most pressing issues that localities have. There's not an option to cut out-of-home care for kids. So that continues to be funded, whereas, there will be cuts to some of the additional supportive services where there have to be. And it's unfortunate because it's exactly at the time when we're trying to make the exact opposite sort of push.
How can journalists get into those numbers? Do you have any suggestions for understanding them, first accessing them, obtaining them, and then trying to decipher them?
It's more complicated than I ever expected. So we spend a fair bit of time. Yeah, exactly. Well, and it's not always fully publicly available. I've spent a lot of time pouring through state budgets, more state than at the local level, and sometimes just end up having to call people to say, what is actually happening? Can you help me piece together the story? Because there's not always a really clear trail. So I mean, this is an easy way out, but I would say the key is knowing who to talk to, the advocates, some of the data folks, the youth, there's youth advocate organizations that have, Kids Count every year, and they have their, the First Focus team at the federal level is tracking budget numbers. So there are some national and state-based experts that I think are really, can be really helpful and can sometimes provide that intel that even with hours and hours, you can't necessarily track through publicly available data.
Michael, there's another question on the list. Do you want to go for that one?
Yeah, thank you. Yes, Kira would like to know if you could please talk about the use of ankle monitors and other electronic monitoring and community surveillance mechanisms. And also, what do you think of jurisdictions that move away from detention to these devices in order to save costs?
Yeah, great questions. So I'm going to be totally upfront here and say that I have not done a ton of research individually on ankle monitors and home monitoring and that type of thing. I think as a developmental psychologist, it sort of runs counter to what we think of as effective practice. I think the jury is sort of out in terms of how effective that is. And it's difficult to try to think about, when we're thinking about electronic monitoring as an alternative to, for example, strategies, community-based strategies that promote positive youth development. I think it's a no-brainer. Absolutely. Let's help kids work on skill building and making better choices and holding themselves accountable and all of that kind of stuff. When you're talking about electronic monitoring versus out-of-home placement of some kind, I think that's a different calculus. And certainly, electronic monitoring, wouldn't be my first choice, but I would probably choose it over, detention unnecessarily. So a nuanced conversation there, a nuanced sort of research to dig into there. But being in the community, I can say definitively being at home, not being an out-of-home placement is definitely the better option for kids. And so when it's an option of detention or not, I would almost always pick not. I guess I could say I would always pick not.
A related question to do with COVID, and it occurs to me that we're talking about, in order to find out the dangers, the actual risks that kids face if they're in detention facilities or lockups, you need testing. You need a lot more attention paid to the cost of healthcare for those kids and for the cost of testing. And we already have a problem with that in the adult system, not to mention the country at large. Is that kind of a hopeless goal to know which kids are in danger, which kids aren't? How do you find out more about that?
Yeah, that's a great question. So increasingly, I think states are being more transparent about what testing is happening. You see some states really, leading the way on that. New Jersey, I believe, committed to testing every youth in facilities. A number of other states have created dashboards akin to the ones that, we can all look up that tell us how many people have been tested and or tested positive in a community. Increasingly, we're seeing transparency around that. That data is not reliably collected in a central source, but it's something I'm actually working on a project independently, not with Urban, but independently trying to collect some information on that, on what testing procedures have been, on how those are changing. Really critically important. And I think it's a little bit of a black box in terms of an easy way to find that information, but I think it's increasingly becoming available. And I think there's a real recognition of a need for transparency around that, and fully fair to contact and ask. You can always reach out and contact the state agency and get their, sort of information on what's happening, and they'll often share.
We have a question from Ron Burler. Michael, do you want to read that?
Yeah. So Ms. Harvell, you mentioned earlier that Connecticut closed its last large youth prison. Ronald would like to know if there is data on the impact that the closure of that facility had.
So Ronald, that's happened recently, and they're still figuring out how, at present, youth are, I believe, being supervised in the local detention centers. And so Connecticut is really in the process of sort of rethinking their approach to supervision for that population. So we did put out, and I'm happy to link or send to you, Steve, we did just do a data snapshot of youth incarceration in Connecticut earlier this year that had an update. But I will say, while the movement to close the facility, I think, is great from a practice standpoint, it's complicated data a little bit, because in the past, we've been able to pretty reliably and pretty easily collect information on all the kids who are in that facility. Now that that's been decentralized a bit, it's hard to get comprehensive data on youth who are placed out of home post adjudication. And so we're in this sort of temporary moment of not having as precise data as we would like, but they're moving towards improvements. So if you want to follow up with me on Connecticut, happy to talk or link you with folks there to understand better what that story has looked like and what the outcomes and impact is that they've seen.
Well, by all means, send us the link and we'll post it as well.
Yep,
so
absolutely.
I think we have room for a couple more questions. We're about 8 minutes away from closing. But one of the fascinating things about your paper is you mentioned at the end that Urban Institute has listed about 4 or 5 examples of creative ways to fund youth services in the future. In the time we have left, can you go over some of the ones that you think are most interesting and what journalists should look for perhaps in their jurisdictions when they cover this?
Yeah, that's a great opportunity. Thank you for asking that. I think so. To your point earlier about that reinvestment element, there's a youth reinvestment fund that was put in place in California. Gubernatorial budget implemented it. The council member who advocated for it is now trying to pass legislation. He has a bill up again. He had one this session. I think it will continue over. It's a really interesting model because it does all of the things that we want. It is granted an influx of new resources, but it is to essentially focus on diversion, community-led strategies to increase the number of kids who are diverted away from the system, which I think at present, given all of the collateral consequences of court involvement, certainly of incarceration, and the racial disproportionality that we see in the system, I think making sure that youth have equal access to off-ramps at the beginning of their engagement with the system is really critical to just sort of stemming that pipeline, keeping youth from getting caught up in the system. And so that's exactly what it focuses on. And the cool thing is that they're tracking outcomes. They have evaluation components and data elements related to it. That you have to document the impact of it. Now it's just starting. So of course research takes forever. I apologize. It's not on the quick reporter schedule, but they will be tracking outcomes that will impact future funding. And so I think it's really going to be a great reinvestment model to see how some of these strategies are working and also sort of the bang for the buck for that initial investment.
I love the example of the Lena Pope nonprofit in Fort Worth.
Yes.
That's really interesting. That's
one of my favorites.
Private profit on its end to fund.
Yep. And we tried to find other examples and haven't been able to find them, but it's a really interesting model. And they had a large campus. It was in Fort Worth, Texas. And it was sort of valuable property, which not all facilities are on, property that's super valuable, but they did really interesting things with all of it. So with some of the buildings, they actually repurposed them to be from being congregate care facilities to, alternative education campus and some other things. They used some of the buildings that existed. And part of this happened because there was some strange agreement in the original. Basically, they couldn't sell it. They're not allowed to sell the land. And so that is something that we have seen happen, that places will, close a facility, sell the land, and have that influx of cash at one point. They couldn't. And so they got creative. They leased it to a developer who built a high-end shopping mall there. It's got the Whole Foods and it's a really nice shopping center that generates, I forget, it's a small percentage that they get of the rent that supports services, but it supports about $1 million annually, which is a significant investment in community-based services for kids there. So I think that model is fascinating and would love to we've really tried to find other examples, and I'm sure they exist. We just haven't found them yet. So I think that's a really interesting one to pursue.
Of course, in COVID, this is not a great economic model for shopping malls since nobody's going.
It's true. I know. I was like, we need something else. We need to think of a different alternative there. Agreed.
I guess, the takeaway, is that, we can afford to think big thoughts in youth justice reform. And the question is, can we afford them? And I think what you're saying is that we can if we're creative enough.
We can. And I think also if we get real about sort of the cost benefit of the different approaches. I think that's another thing that sometimes we underestimate the value of getting a kid back on track, right? We don't factor in the cost of them, continuing on and engaging in the criminal justice system. Like I think there's an argument to be made for investment early. And while juvenile justice investment sometimes comes late in the sort of life of a child, it's early in terms of the rest of that child's life. And so I think there are some really compelling arguments to be made from kind of a cost benefit perspective of investing in kids and investing in communities and providing the support that they all need, justice involved and otherwise. And I think there's a real, I do feel like, having been in the field for some time now, we've hit a pivot point, and there's more of a conversation of that. There's a lot, for those of us who work in kind of the justice reform space, we're spending a lot of time thinking about what do we do if the justice solutions are not in the justice system at all, and really trying to figure out how to service broker and partner and invest in grassroots organizations that have relationships and long-term commitment to these kids and their families, and help them get themselves sort of back on track and long-term on a really positive trajectory to achieve great things like all kids.
I have to ask this because we're in the landscape we're in now, but are you finding bipartisan support for this?
This is one, so I will say in the time that I've worked in it, absolutely there is bipartisan support for investing in kids. And I think it's because it works. It pays off. Intuitively, people understand it, and increasingly, research is showing that the earlier we intervene, the more we can keep kids at home and in communities, the better they're doing. And so I think that's leveraging that information and that data to make smart policy and practice choices is always going to be a bipartisan opportunity.
So that's a very hopeful note to end on, because we need as many hopeful notes as we can.
I know, right? I'll take whatever I can get.
We'll take whatever we can get as well. So Samantha, thank you very much. You packed a lot of material into a short time. If you guys have any other questions, please just send them to me, and I'll send them over to Samantha, and she can answer them, and we'll post the answers on our website. And this pretty much concludes today's session. That's program 2 of our next steps in youth justice reform. Our next panel, as if you look at your schedule, is next week, next Thursday, October 29th. So take a look at keep watch on our website. I'll send you all a reminder next week about who's on. There may be some changes in our agenda, but we'll keep you informed. And any questions, of course, just send them to me or to Joe. Again, thank you all very much for staying with us this afternoon. And Samantha, special thanks to you for joining us.
Thanks so much, Steve, and everybody. Appreciate the opportunity.
Thanks, everyone. Have a great weekend. Goodbye, everybody.
You too.